So why is this limited to so few countries and so few centers? And primarily this is because the current state of the art to produce gene-modified blood cell therapies is very complicated. So traditionally you have the patient shown here on the left who is undergoing their treatment in the clinic, in this case an apheresis process to collect white blood cells. Those cells then have to be transferred to a lab where they're manually prepared to have the stem cells and or T cells isolated from that product. That is done using a set of markers. So if we're looking for a stem cell, we would use something called CD34. If we're looking for a T cell, we could use something called CD3, CD4, or CD8.
Don't forget to mute your lines, please, so we can limit background noise. Thank you.
And what I'm showing here is the first-generation device that we use to separate out these cells from the rest of the white blood cell product. Once we have those cells, they then have to be transferred into a clean room facility, and they're further manipulated by hand. Here they're exposed to the reagents that we use to accomplish the transfer of therapeutic genes. They're cultured under conditions that simulate the human body. But basically, this is very much done by hand by individuals who are highly trained. Now, because the cells have been outside of the patient's body, have been exposed to the air, have been manipulated in many different ways, the potential that they've been exposed to infectious agents is increased, so they have to undergo a pretty stringent testing process to make sure that they are suitable to go back into a patient, especially if that patient was previously treated with chemotherapy to basically knock out some of their immune system. And after all of that, then the cells go back to the clinic where the patient is located to be reinfused. And all of this needs to be done under what the FDA deems current good manufacturing practice, or GMP infrastructure, which to develop the clean rooms and testing facilities is a multi-million-dollar endeavor. So to do this with stem cells currently takes somewhere between 2.5 and 4 days. To do this with T cells in current clinical trials takes about 5 to 14 days.